Hi, this is Sharon Coronado, and this is my eyes, ears, nose, and throat exam, and this is my patient Daniel. We're going to start with the Snellen distance reading chart, and we're going to test just one eye, and then if we were doing the other, we'd also test the other eye, both eyes, and then together. But for now, I'm going to have you just close your right eye and read the smallest print you can see here from 20 feet.
LEFCOPCT FEPLTCEO.
Okay.
And I can't read underneath that.
Okay, very good. That's 2015, and I'll have you have a seat. And now we're going to test your near vision with a Rosenbaum reading test. And I'm going to have you hold the 16 feet away and read to me the smallest line.
You mean 16 inches away?
16 inches away.
ELTCFPDOE.
Okay, very good. And I'll have you just take your glasses off. And I'm going to test first your corneal reflexes. I'm not going to put this in your eye, but I'm going to get it close and see if it elicits a blink. And they both blinked equally, which is good. Reflex. And next I'm going to test your eyes to see how your tracking is with your eyes. Hold your head straight. And I'm going to have you look to the side with your eyes. Up. Down. Over all the way. Up and down. Your eyes track equally, which is great. And now I'm going to check your pupils by shining a light into your right eye over here. And it constricts, and I also see in the other eye it equally constricts with a consensual constriction. Your pupils are round and equal, reactive to the light, and accommodating on both sides. And next I'm going to check your peripheral vision by having you put your hand over your left eye and look at me, and I'm going to ask when you can see my hand coming across. You see it over here?
Mm-hmm.
Okay,
Yep.
you see it coming up this way, coming over the top,
Mm-hmm.
and then one more coming this way.
Mm-hmm.
Okay, great. Okay, next I'm going to just check your eye in general. I'm going to just press first on your lacriminal duct here, see if there's any drainage. There's none. His eyelashes go upward, curl upward. His brows go from the inner to outer canthus. Sclera is white, and conjunctiva is nice and clear. I'm going to just shine my light quickly into your eye again. And there's no films or anything over his eye. Okay, next we're going to move on to the ears. First thing I'm going to look at your ears in general. They're nice and symmetrical. They're pretty much even with the outer canthus of the eye. They're a nice normal shape size, no lesions or anything. Does it hurt when I pull on your ear?
No.
Or up here?
No.
Or pressing?
No.
Okay, I'm going to look into your ear with an otoscope. Okay, and when I look inside, I see that your tympanic membrane is like pearly gray colored. There's some cerumen in there. I can see the bony structure, but I can't see the cone of light. There's a lot of cerumen's in there a little bit. Okay, next I'm going to test your hearing. I'm going to have you cover your left ear. Just put your hand over your left ear. I'm going to come over here and I'm going to say 3 words, and I want you to just tell me what they are.
Cat, dog, mouse.
Okay, so it was cat, dog, boat. That's okay. Okay, next I'm going to test your hearing with my tuning fork. And I'm going to place the tuning fork on the top of your head, and I want you to tell me if you hear it equally.
Yeah, more on the left side.
Okay. All right, that's the Weber test. This is a test for air conduction versus sensory neuroconduction. Okay, I'm going to press this on your mastoid bone. Tell me when you don't feel it and hear it anymore.
Not hear it.
Okay, on your chest one more time.
I hear that now.
Tell me when you don't.
hear it. I hear that.
Tell me when you don't.
I still hear it. I don't hear it.
Good. Your ear conduction, which is normally a little bit longer than the other one. Excellent. All right, so now I'm going to move on to your nose. I'm going to just look at your nose really quick. I notice that it's nice and straight. I don't see any deviations. There's no lesions. It's equally colored. Just going to look in your nose, and when I look inside your nose, I see some bills here, no swelling, no drainage. I see the lower turbinate, the tip of the lower turbinate. And I'm going to press on your sinuses, and just tell me if you feel any pressure.
Mm-hmm.
And what about up here? Do you see your frontal?
No.
Okay, and one more test. I'm going to just to see if there's any air versus fluid in your sinuses by shining a light. It's transillumination. I'm just looking, see a nice pinky light. Okay, I'm going to check up here. See pinky light. Okay. And then I would do the other side as well. Okay, next I'm going to check your mouth and your teeth and all those things, your pharynx and your tonsils. Looking at your lips, it's nice symmetrical, there's no cracks, no lesions, no discolorations. And put your teeth together for me. A little overbite, which is totally normal. I'm going to just use my tongue depressor. I'm looking at your tongue. Nice papillae on the tongue. It's nice and symmetrical. I'm looking around. I'm just going to shine my light really quick. At the buccal mucosa, I see the opening of the parotid gland there. And I'm looking around. Lift up your tongue. The lingual frenum is intact and his tongue is mobile. I noticed he does have some fillings and he's missing some teeth on the lower, his molars on the lower left there. And looking up at the hard palate, it's nice and even, no tori. There's some transverse rugae on the hard palate, and the soft palate is pink. No discolored patches. And his lips on the inner lips are nice and pink. And sorry, I don't mean to gag you, but hold on your tongue a little bit, and he's fighting me a little bit. Okay, so he has tonsils that are about 2+ on either side. There is no discolorations, no patches. His pharynx is pink. I see no patches, no discolorations. And that ends our assessment. Thank you.